Can you just give us a brief overview of the HPV situation in Canada, especially as relates to cervical cancer? How prevalent is it and that kind of thing?
Well, HPV is highly prevalent throughout the world because we know that it's a very common virus that's associated with sexual activity. And it's as soon as someone starts having sexual activity, it's very likely that they will be exposed to the virus. And usually most people just eradicate the virus on their own. But a small percentage will go on and have difficulty with it. So we know it's out there in Canada and everywhere else, and it's very common. But there are a lot of new initiatives to prevent the bad things that HPV can cause, like cervical cancer and other cancers, with vaccination that has come out since about 2008, and the school-based programs working very effectively. We're going to have a whole generation of people that won't have to worry as much about getting the bad effects from HPV, which are not many people, but if it affects you, it's huge. So that's been very successful, the school-based vaccination programs, which have now expanded to boys in I think every province. And then we're looking at improving our screening programs, which are for cervical cancer. And so that's been traditionally cytology-based screening. And we've got good intervals for it. We're continuing to spread the word that you should get your pap test, and it's a way of preventing any of the bad effects that can happen in some women with HPV. Mm-hmm. If it sits for years and causes the cells on the cervix to go from a normal state to a precancerous state and then potentially to a cancerous state. That's been the most important message we've had for women, but now we're looking at different tests that might actually work better to pick up more potential precancers and cancers, and so a number of provinces are exploring these new things too. So there's a lot of new developments in Canada that are being rolled out in the provinces at different timelines.
What about is there stigma associated with cervical cancer? Or I was asking you earlier about HPV and STIs. It's sort of this funny one.
It's really unfortunate that there is a negative stigma. It shouldn't be, because we can't procreate. We can't have another generation of people if you don't have intercourse at some time. And so that's a very healthy, necessary activity to have. And before we knew that HPV was a causative agent for cervical cancer, we knew that there were some proximate factors that told you that someone was at greater risk. And so if women had started intercourse earlier, like in their teens, and had children early, or had intercourse with a number of sexual partners, we knew you were more at risk of getting cervical cancer. And so that got stereotyped in it. But we always say it just takes one partner and bad luck to be exposed to a virus that could potentially go on to cervical cancer. And that's not as interesting to people as the negative associations. But it's just that for whatever reason, women think of STIs, or the public thinks of STIs first, and because HPV is a virus and it's spread through sexual activity, that's paramount on their minds, that if I have HPV or an abnormal pap smear, somebody gave it to me, my partner cheated on me, all hell breaks loose. And that's not the case. It's just very common. As I said, virtually every woman who's had exposure to sexual intercourse will be exposed to HPV and most likely will get rid of it.
You had a phrase for that.
It's like the common cold of the lower genital tract. Yeah, and some of my colleagues say it's the common cold that's a lot more fun to get, but I just
leave it at that. Yeah. You've touched on it, but what kind of impact do you think the HPV testing and vaccine is ultimately going to have on cervical cancer, but other cancers too?
I think the vaccine is going to have a huge impact. We know that the original vaccine that most of the school-based programs are based on will control or eradicate 70% of cervical cancers. They had HPV 16 and 18 in that vaccine, and the newer vaccine covers even more HPV types, and they might be able to eradicate 90% of cervical cancer. So that's really exciting. But it's going to take time, because the school-based program, the kids that are approaching 25. It's going to be in a year or two, and they're not going to have all of these high-grade abnormal pap smears that previously we'd be watching for. And so if you look at demographics, it's probably going to take 20 to 40 years before we're actually going to see any impact on invasive cancer rates. And most people like to see instant, response. It's like, okay, well, I've started it next year, I want to see a benefit. And this is going to take more time. But it will be very profound. And already we know that we are seeing less severe abnormalities in women who have had the vaccine, and less problems with abnormalities further. So that's slowly percolating through the system.
I was going to ask that question because there's the kids who are school-aged in 10 years, but women sort of 25 and older, what would your advice be to them in terms of looking after their sexual health, and possibly they have been exposed to HPV?
Well, most likely they have. And again, it's sort of like little kids all get exposed to lots of viruses, and their parents think that they're always sick and getting leukemias and things from their children. But the most important thing is to make sure that you get your screening done. Like, that is by far the most important thing for now for a woman to take care of herself to prevent cervical cancer. If she's able to, if she's in a position or a situation where she can access the vaccine, she's able to receive it, that's an extra layer of protection that she would benefit from, and that might prevent other problems like further abnormalities in the future of a percentage. But again, it's very personal, and I didn't respond back to you, but the vaccine is also very helpful in preventing anal cancers for both sexes, and head and neck cancers for both sexes as well. And so that's why they've implemented in little boys now in the school-based programs, and it's available for men.
The last question I have is, you mentioned in your talk earlier today that getting HPV screening is one thing, and and there's also PAP screening, but the time factors and so on.
Huge.
What do you tell your patients, or what do you tell women?
Well, in Canada, traditionally, to be able to get women to come in for screening and to see it as a social good, because a lot of women still aren't screened. Half of our patients who come with cervical cancer have not had a pap smear ever, or haven't had one in over 5 years. And so that's the biggest problem. Well, we've been saying do it annually to try to attract the women who don't participate. And unfortunately what's happened is the women who come always come, and the women who don't come don't come. And we know that you don't need to be screened every year. Screening once every 3 years gives you virtually the same level of protection as every year. And that's the PAP test. But the HPV test, which has been shown to actually pick up more abnormalities, especially the ones deeper in the cervix, which are harder to detect, that only needs to be done once every 5 years. The protection factor, if your test is HPV negative, we know badness can't happen to you for 5 years. You should be safe for 5 years. But trying to translate that to the general public, after we've been telling them you have to come every year, well, maybe now 3 years, you can come every 3 years, but to translate it into 5 years is good, within a couple of years, women they don't believe it.
Yeah.
Right? And so it's going to take a huge amount of education and comfort and reassurance that this test, if it's given in Canada or in the provinces, it is a good test, and it will be safe for 5 years. And you don't need to have it every 3 years.
Yeah.
But that's going to be a lot of education.
I lied, one more question. Eradication, do you think that's possible? Of the HPV related that's related to cervical cancer anyway?
I think, nothing is 100% in medicine. There's always some outlier. But virtually 100% of cervical cancer should be able to be eradicated with the newer vaccine that's come out, the nonavalent Gardasil. I say that because that's the only vaccine that's out there in Canada. But it should eradicate it, I would think. I'm guessing within a couple of generations there should not be cervical cancer. And if there is, it would be very, very rare and unrelated to the virus.